When entering a patient's room, the nurse will perform hand hygiene, ensure privacy, introduce themselves, and identify the patient using two identifiers.
Can I get you to verify your first and last name and your date of birth?
Yeah.
Verify you
Juno,
have the right patient and your healthcare
7/5/1952.
provider's orders.
All right, excellent. Any reason we wouldn't be able to perform this today?
Assess the patient's tolerance for activity and musculoskeletal functions.
No? All right, excellent.
Ask if your patient needs to void. Arrange your supplies on the overbed table. Raise the bed to a comfortable working height and lower the rail on your side. This is a good moment to put on your gloves. Drape a bath blanket over the patient. Ask your patient to hold the top or ask another nurse to help as you remove the bed sheets beneath it. Dispose of the bed sheet in a dirty linens bag. Adjust the head of the bed if necessary and remove the gown. If the patient has an IV line, an injury, or reduced mobility on one side, start with the unaffected side first. To remove an IV line, pause the fluid infusion and take the container off the pole. Then, get the container and the tubing and slip it through the arm of the gown. Do not remove the IV line from the patient. Fill the wash basin 2/3 of warm water. Have your patient test the water temperature. Remove the patient's pillow. Place a towel behind the patient's head and one towel over his chest.
Juno, are you wearing contact lenses?
Ask your patient if he's wearing contact lenses to protect his eyes. Begin the bath by immersing the washcloth in the basin. Then wring it out thoroughly and fold the washcloth to form a mitt. Wash the patient's eyes with plain warm water from the inner to the outer canthus, and using a new section of the cloth for each eye. Then dry. And wash the face. You may ask your patient if he would like to use soap for the face. Ask a male patient if he would like to be shaved.
Would you like to be shaved today?
No, thank you.
All right, excellent.
Remove the bath blanket from the arm that is closest to you and place the bath towel under the arm. Bathe the arm with water and minimal soap, with long strokes. Move from a distal to a proximal direction. Wash, rinse, and dry the entire arm. Wash the hands and the nails. You may immerse the hand in a wash basin if the hands need to be soaked. Raise the patient's arm. Wash, rinse, and dry the axilla. You may apply deodorant at this time. Repeat on the other arm. Cover the patient's chest with a bath towel and fold the bath blanket down to the umbilicus. Then bathe the chest again using long, firm strokes. With a female patient, take special care to clean the skin beneath the breast, lifting each breath with the back of your hand. Check the water temperature and change it if necessary. Continue washing the abdomen. Drape a towel over the patient's chest and abdomen, folding the bath blanket down to just above the pubic region. Continue bathing the abdomen. Pay close attention to the umbilicus and surrounding skin folds. Dry the area and help the patient put a clean gown.
So this will come back up.
You're bringing the sheet back up, removing the towels.
You may continue bathing the patient before helping him get dressed.
So it'll be under
Expose one leg by folding the blanket toward the midline. Arrange the towel lengthwise under the leg. Wash the patient's leg from the ankle to the knee, and then from the knee to the thigh. As you bathe, make sure to assess for signs of redness, swelling, and pain. Proceed to wash the foot, cleaning carefully between the toes. Clean and file the nails as needed according to agency policy. Soaking the patient's feet for 10 minutes will help maintain cleanliness. Never soak a patient's foot if they have diabetes or impaired sensation. Remove the towel and repeat the same steps on the other patient's leg. While the patient is supine, provide perineal care as needed. Change the bath water. With fresh water in the basin, apply a clean pair of gloves. Lower the side rail and help the patient into a prone or sideline position. Place a clean towel lengthwise along his back. Wash, rinse, and dry the patient's back, working from the neck to the buttocks, using long, firm strokes. Cleanse the patient's buttocks and anus, moving from the front to the back, paying special attention to the folds in the area. If fecal matter is present, enclose it with toilet tissue and clean the area with disposable wipes. Replace the absorbent pad if necessary. Help the patient back to a supine position. Then, help him put on a clean gown. Provide clean bed sheets. To assist with a tub bath or shower, first assess the patient's fall risk status. Review precautions concerning his condition and review the healthcare provider's orders. If this intervention is still appropriate, schedule the use of a tub or shower. Check the tub or shower for cleanliness. If needed, clean it accordingly to agency policy. Place a skid-proof disposable bath mat in front of it. Assure that all necessary supplies and linens are available and indicate the tub room is occupied. The patient wearing a gown, robe, and slippers assist him to the bathroom. Demonstrate how to use a call signal for assistance. Start the water running, adjusting the temperature. Also show him how to control the hot water. Instruct him to use the safety bars when getting in and out of the tub or shower. Make sure that bathing supplies are within reach. Check on the patient every 5 minutes.
Hi, Juno. I just wanted to
Make
make
sure
sure
you
you're
tell
doing
him
okay in there.
that he cannot stay in the bath for more than 20 minutes.
You're welcome.
Oh, wonderful. I feel very
Assist the patient with getting out of the tub. If the patient is unsteady, Drain the tub before he attempts to get out.
Whoosh.
While helping the patient dry off, observe his skin for any dryness, redness, flakiness, scaling, or signs of breakdown. Remove your wet gloves, perform hand hygiene, and help the patient dress in a clean gown or pajamas, slippers, and a robe. Then help the patient back to his room and into a comfortable position in a bed or in a chair. Evaluate his tolerance of the bath and shower and his level of fatigue. Return to the bathroom and replace supplies in the appropriate storage area. Then clean the tub or shower according to agency policy. Before applying any topical administration of medications, check the medication administration record, or MAR, against the provider's orders twice. After performing hand hygiene and ensuring privacy, introduce yourself to the patient. Then identify the patient using 2 identifiers. Ask if she has any allergies. Then do a third check of the MAR at the bedside. Also check the expiration date of the medication.
Do you have any allergies?
No.
As you proceed, keep in mind the 5 rights of medication administration. Like clean gloves, if the patient's skin is not intact, it may be necessary to use sterile gloves. Clean and dry the area. Place the required amount of medication in the palm of your hand and warm it up by briskly rubbing your gloved hands together. Spread the medication even over her skin using long strokes in the direction of hair growth. Avoid rubbing the skin vigorously.